The first test we're going to do is the Thompson test, and for this one, my patient is going to be supine, and I'm going to have her legs extended and her arms across her chest, and I'm going to place my hand under her lumbar spine, and I'm going to feel for any lordosis or pelvic tilt, and I'm going to flex her hip, fully flex it, and I'm going to feel her back tighten against my hand on the table. And this test would be positive if if her flattened leg flexes at the hip or the knee, and that would indicate a hip flexor contractor. Um, and so if that part is positive, I would move on to part two, which is only performed if part one is positive. And for part two, I would try and push down that leg that came up. And if this increases her lumbar lordosis, that would confirm that she had a hip flexor contracture. And so the next test we're going to do is the Kendall test. And for this one, I'm going to have my patient sitting supine. And I'm going to have her flex the uninvolved leg. So she's going to hold it and flex it, and she's going to roll back. And if the involved leg extends to relieve some of the tension on that muscle, that would indicate a rectus femoris contracture. And if that part is positive, I would move on to part two. And for part two, I only would perform if part one's positive. And for this one, I would just palpate that muscle. And if there is no palpable tightness, it could indicate that she has a tight capsule or ligaments. And if the hip abducts during that test, it could also indicate that the IT band is tight. And so the next test we're going to do is the piriformis test. And for this one, I'm going to have my patient side lying on the non-test side. So I'm going to have her turn this way. And I'm going to be testing the leg in 60 degrees of hip flexion with the knee flexed, and I'm going to stabilize the pelvis and apply a downwards pressure on the patient's knee. And if she has any tightness or pain in the hip or buttocks area, that could indicate that the piriformis is tight. But if she has any pain in the buttocks and the posterior thigh area, that could indicate that she has sciatic nerve impingement due to her piriformis being tight. And so for the last test we're going to do is the Trendelenburg test. And for this one, I'm going to have my patient standing. And for this one, she's just going to stand on one leg. And if her free leg side drops at all, so if this leg dropped, that could indicate that her gluteus medius is weak.